Ear infections, also known as otitis media, are a common problem among children, but they can affect adults too. In this video, we'll take a closer look at how ear infections develops, some tips to avoid it, and some do's and don'ts to keep in mind. The ear is made up of three parts: the outer ear, the middle ear, and the inner ear. Otitis media occurs when the middle ear becomes inflamed and infected, often due to bacteria or viruses. Bacteria or viruses can enter the middle ear through the eustachian tube, which connects the middle ear to the back of the throat. The eustachian tube is usually closed, but it opens when we swallow, yawn, or chew gum. This allows air to enter the middle ear and equalize pressure. However, if the eustachian tube doesn't open properly, or if it becomes blocked by mucus or swelling, the middle ear can become a breeding ground for bacteria or viruses, leading to ear infections. So, how can we avoid frequent ear infections? First and foremost, practice good hygiene, like washing hands frequently and avoiding close contact with people who have colds or other infections. Frequently blow your nose gently and one nostril at a time to avoid pressure building up in the middle ear. If you're swimming, wear earplugs or use a swim cap. If you or your child does develop otitis media or ear infection, there are some do's and don'ts to keep in mind. Do see a doctor if you or your child has symptoms like ear pain, fever, or trouble hearing, trouble sleeping. Don't try to clean the ear with other objects, as this can push wax or bacteria further into the ear. Avoid exposure to second-hand smoke. By following these tips and being mindful of good hygiene practices, you can reduce the risk of developing otitis media and keep your ears healthy.